Hi. So I just want to tell you guys 3 reasons why I hated clinicals. I hated it so much. Now, disclaimer, I'm not a makeup artist. I do not know how to do my makeup. So if you see anything wrong, just okay. So number 1 reason why I hated clinical. So I'm insomniac. That means I have difficulty sleeping throughout the night most nights. So usually around 2 a.m. every night, that's when I start getting sleepy. It changes if I take something like melatonin or if I'm really tired. So on clinical days, I usually have to be up by 4:30 a.m. And on most days, I will be running on like 2 to 3 hours of sleep. So running on 3 hours sleep and clinical is usually like 12 hours. I don't like coffee, so I just raw dog it every single clinical day. And on clinical days, you have to come and be all happy and ready to learn. I'm usually barely alive, so I just hated it. I really hated it. You get some instructors that will tell you you have to look awake and look excited. I'm like, please just leave me alone. It's just torture. It's just torture every single clinical day. So yeah, that is number 1 reason why I hated it. You have to be up by at least 4 or 4:30 a.m. and then you have to get to the hospital by 6 a.m. and you have to do handoff reports with your nurse around 6:30, 6:40 a.m. and on top of that, you have to find time and do your paperwork. It's just it was just so much torture. I just couldn't do it. Another reason why I hated clinical was the nurses. Now, I have to preface this by saying the nurses have no obligation to allow us to follow them. They don't get paid more, they don't get any more credit or whatever. They are just doing it from the goodness of their hearts. However, the nurses, like most of them, don't like student nurses. They don't like nursing students at all. And it's because they know exactly what goes through the nursing students' mind. We are always judging them. We are judging how they do their work. We are judging how they treat people and their patients, because all we know is book knowledge. We have no experience whatsoever, and they have all the experience and they have spent a lot of time with their patients. So sometimes being a nursing student, you've been taught that you go from 1, 2, 3, 4, but because that nurse has been with their patient for a while and things have changed and a lot of things are playing into it, they might skip step 2, but we don't know a lot of information, right? So we go, oh, why did she skip number 2? And at the back of our mind, we can't help it. At the back of our mind, we are judging them and they know it. So on top of having all these patients and having students looking at them and judging them, it's not something they really enjoy. So because of that, most nurses don't like students. They don't like nursing students at all. Like one time I had a nurse tell me, after introducing myself and telling her, hi, my name is Anita, it looks like I'm paired with you, so nice to meet you. She looked me dead in the eye and she was like, I'm not going to be your babysitter. I don't have time for you, so if you can keep. I was like, oh my gosh! Excuse me? She was like, I don't have time for you. I am not going to be your babysitter. If you have any question, fine, you can ask, but don't get in my way. I was like, oh, hello. I've heard some stories where nurses tell students point blank, I don't want you. Don't follow me. Tell your instructor to choose another nurse. I was like, whoa. Yeah, so having all that attitude on top of everything, it just makes us feel like we are not wanted, right? And it's not a very nice feeling to have. So clinical days can be really tricky for nursing students, and it was very tricky for me, who is also on a 3-hour sleep, barely alive. If I get that kind of attitude, you're just gonna ruin my whole day. So yeah, that's number 2 reason why I hated clinical. Now, the 3rd reason why I really hated clinical was the fact that as a nursing student, when you're on the floor, most nurses, actually it's not even most nurses, it's the CNAs and PCPs, they think you are an extra hand to help them with their duties. Now, I don't mind changing a patient, I don't mind bathing a patient, I don't mind doing all the things that a CNA is supposed to do, but I will not do all of that if my nurse needs me to help her do something, right? So usually I'm there to shadow a nurse. So what she is doing is what I am doing. If she's changing a patient, I'm changing a patient. If she's feeding a patient, I'm feeding a patient, right? I don't think that is too hard to do. However, if like I get a little bit of time to look through my paperwork or the patient chart just to find some information, and some CNAs or PCPs will think, oh, she's free, we can pull her to help us, change a patient. And I'm like, I'm not here to do your job. I'm sorry. I have to do some paperwork, right? I have to look through the patient's chart. I have to do things with my nurse. However, you have to be very careful with how you word it, because you don't want to come off as you are too good to do those things. So it becomes like a game. You're not only getting attitude from your nurse. If your nurse has an attitude, you are getting attitude from the CNAs and the PCPs. And talking about paperwork, right? You have so much paperwork to get to, but you still have to help your nurse. If your nurse is doing something, you have to stop doing whatever you are doing and go help her, and then sacrifice your paperwork, which by the way is just too much. It's just too much work. It's redundant. It's a lot of things to look through. You don't have enough time on the shift. Although 12 hours seems like a long time to do everything, it really isn't enough time to do all of it. So now you are chasing time and you are trying so hard to do all of that within the time frame, and it's just too much hustling. I really don't mind. I have to say this, I don't mind, but it's just when everything is just combined, when you're running on 2 hours sleep, you are an introvert, you are overstimulated with other patients, you did your paperwork, you probably changed the patient, all of that, it just becomes way too much. And you're doing all of this without payment, okay? You are doing all of this without payment. Although I've heard some rumors that they now want to pay nursing students to do their 12-hour shift, which I think is a very good idea, because it's a lot of work. Although you're not directly responsible for any patients and their care, you are still doing a lot. You are still doing a lot, and you should be paid for it. So ideally, you want a nurse who is excited to teach you, right? You want a nurse who is excited to teach you and will ask you questions and will let you do all these cool stuff on their patients. But on clinical days, again, when I'm running really low on energy, on sleep, and every other thing, I just want to be left alone. I just want to be left alone. And if you ask me a question, of course I'm going to answer it, but sometimes my mind is asleep. My mind is running on very low battery. So sometimes a very easy question that I know, because my mind is not computing, I either think it's too easy or I don't know the answer. And then I come off as dumb. I come off as if I don't know anything. One time a nurse asked me, oh, so why do we give Tylenol? And I was like, are you trying to trick me? Of course, everybody knows why we give Tylenol. Like the number 2 reasons why we give Tylenol, right? But in my head, I thought she was trying to trick me. Maybe there are more reasons why we give Tylenol that I don't know about. Because the only reason why we give Tylenol is for fever and pain. Those are the 2 main reasons why we give Tylenol. And I thought, that is too easy. Maybe she's trying to, I don't know, teach me something I already don't know. So I was like, well, the patient has a high fever. She said, And then she said, what about the next reason? I'm like, it can't be pain. Because Dash, he's in pain. And if he's really in pain, maybe, I don't know, morphine. I don't know. It can be Tylenol. But that patient was having some heart issues. And his blood pressure was, I think, really low. So they cannot give high dose of pain meds, which is the morphine. So Tylenol was the best option for them. And I couldn't compute it. My mind couldn't, think that far. I was like, she's trying to trick me. And so I said, I don't know. And she gave me a look. that I don't think she knew she was giving me the look. She was like, but to me, it looked like, really? And I felt so dumb throughout the clinical. She was like, pain. I'm like, duh, it's pain. Of course it's pain. But of course I couldn't explain it to her that I thought she was trying to trick me or something. So I let it slide. I'm like, yeah, I think it's fine. I think it's fine if you want to think that I'm like dumb. I don't care. I just want the clinical day to be over. And do you know what the funny part is? It is probably going to be worse when I start working, because when I start working, I'm going to be responsible for all these patients on top of every other thing. But now, thank God, everything is done, and the only thing left is to write my finals, and then next week I do my pinning and my graduation. I cannot believe that I'm actually graduating. There was a time that I really thought I was not going to graduate. There was a time that I was really determined to drop out of this program. This program has been really hard, and I can't wait to tell you guys what my journey actually looked like. I was seriously thinking about dropping out, but hey, who's graduating next week? Hey. I am. Okay, I'm all done. What do you think? You think I did a good job? Okay, bye.